Hello, I'm Dr. Ian Holsworth. I'm the Surgical Director here at VetSurg. We'd like to welcome you to the practice. This is a practice that we have built in order to provide the pets and the people of Southern California with specialty care at the highest level. It hasn't been easy. It's a difficult process, but we're very proud of what we've been able to achieve and what we can offer to you in order to help your pet get better. Safe, effective and thoughtful care is what we live by. And our team is focused on making sure that your pet gets the best possible result from the time spent with us and a surgical intervention that aims to achieve a pet who can return back to a full and good quality of life. This is our consultation area. We designed this consultation area to make sure that we maximize patient comfort, decrease their anxiety, but also provide consultation rooms that vary in size and what they offer to cope with the variable size in our patients, from a Chihuahua to a Great Dane, but also cats as well. The less stress our patients go through when they're being examined and we're going through the consultation process, the better the answer that we get and the more accurate it is. We have access to the outside. We can take a dog who has a lameness issue and we want to examine their gait, and what we can do is take them outside, walk them outside on a different surface in the outside environment, and that's often very helpful if we're trying to get an answer that may not be obvious when they're inside. The rooms themselves vary in size. Some have drop-down tables for the smaller patients, some don't need them for the bigger patients. We've tried to make sure that it's comfortable, it's clean, and everybody feels comfortable in that area. During the consultation process or during revisits, patients will come to this area. There is a series of large and small beds for them to rest comfortably during that process, and we have examination stations for the smaller patients. At these stations, we're able to use light to visualize areas and to be accurate with that visualization. We have state-of-the-art equipment to monitor them during that process. Sometimes a light sedation to allow them to relax during this process is needed, and it's important that during that process they're safe. The team that works in this area are experts in this area. They are able to provide restraint, care, support, and do that in a safe way. This is one of the radiology suites we have here at VetSurg. We have 2 suites and we use multiple different ways to image animals pre-surgery. This is digital radiology and it's a very important part of our process. We also have mobile, X-ray, and fluoroscopy as well. So all of these modalities need to be housed and used effectively, and this is where the digital images are collected and then transferred through our system to be analyzed, measured, and we move on to the procedure. Following consultation, examination, and imaging, we will then move on to making our diagnosis, and that may involve surgical treatment. Surgical treatment will be scheduled, and on the day that you return with your pet to the hospital for the surgical procedure, one of the most important early steps is anesthesia. Anesthesia is important and must be safe. This area is our anesthesia induction area, and we have multiple anesthesia induction stations for our patients. The team that works here is very focused on making sure this happens in an orderly and safe fashion. These stations are designed so that we have a transport trolley, we have lighting, we have monitoring equipment, the anesthesia gases, all the accoutrements that's needed to make sure that anesthesia happens well. Out here, the patients are also clipped and then transported, often through imaging, to collect some more images just prior to surgery. Once they move into the operating room, they need to be sterile and ready to go. And this is where that process comes to life. Following anesthesia induction and pre-surgical imaging, it's time to move the patient into the operating room. This is one of our operating rooms. And as you can see, it's specifically designed for surgery. What you need to do when you create an operating room is create a space that is big enough to be able to perform that procedure in a comfortable fashion with plenty of room for the surgical team. And that surgical team will include an anesthetist, 1 or 2 surgical assistants, a surgical administrator, and the surgeon themselves. As you can see from the equipment that's here, anesthesia is provided by the machinery on this equipment boom. And this boom is unique in that we have designed it so that the oxygen that's supplied to the patient, the nitrogen to run surgical equipment, and the waste anesthesia gases enter and exit through this boom structure. This boom is very maneuverable and can be placed wherever is suitable for each individual patient and the procedure that we're doing. As far as surgical lighting is concerned, we have 2 lights, and these surgical lights are on a boom system, and they can be moved, rotated, placed so that lighting of the surgical site is optimized. Within this camera is the ability to collect images of the surgical site, and those images can be used to record surgical procedures, but also work in an immediate fashion if we're troubleshooting issues. Surgical monitors are placed around the room. We have 2 monitors on this boom system, and as you can see, these can be moved to the ideal position. On the monitors can be displayed X-rays, CT images, MRI images, ultrasound images, and we are able to look at those images during the procedure and make decisions about which way to move. Surgical planning is then relayed directly to the surgical team. The surgical table is very important. You need to have a table that is comfortable, padded, warm, and can be manipulated. This is a human surgical table, so it has the ability to tilt in multiple directions, and in that way we can bring the patient to the ideal position for the procedure without having to move the patient excessively. All of these features are supported by the environment they're in. Air conditioning, very important in surgical areas. You need to have fresh air in and used air be removed. That's called laminar airflow. And all of our 4 operating rooms have the same level of surgical air conditioning. Together, it builds an environment where you can do excellent surgery and maximize the result for the patient. And what we're trying to do with this design is get to that point. It's ahead of the curve. It's taking advantage of a lot that's been learned in human surgery. And we brought that to you so that your pet can benefit from that planning and that experience. Following completion of the surgery and any post-operative imaging that's needed, the patients are transferred here to the patient care ward. This is where they will recover from anesthesia initially and then be cared for until their discharge. It's a very important area of the hospital. This is where the patient comes back to consciousness. So we have to really focus on making sure that that process is well supervised, attention to detail is placed, and that the patient itself wakes up in a warm and comfortable environment. We did something a bit different here. We designed our own recovery beds, and by doing that and formulating custom recovery beds, we were able to address some of the challenges that we find with standard recovery kennels. These are all glass fronted, and so that keeps the noise down, it keeps them insulated, and allows us to see them continuously in an unobstructed way. Within these kennels, we have comfortable beds. And so there's nothing better than waking up in a nice, warm, comfortable bed after you've been through something as arduous as surgery. We want to make sure that our patients are well looked after all the time. And after surgery, there'll be monitoring, there'll be fluids, there'll be medications, and there'll be people with them. The staff that work in this area are incredibly focused on making sure that surgical recovery goes smoothly and the patients are made to feel as supported as possible. We watch for signs of anxiety and distress and discomfort, and we do our best to neutralize those factors and really make sure that the patient recovers well. When they come home to you, we want to make sure that the early hard work is over and that you're able to take on your role as their recovery nurse and do it with a patient who's ready for that stage. Patients will stay here 1, 2, 3 nights, depending on the procedure that they have. Most of the patients spend 1 night after anesthesia before they go home. The staff here are here 24 hours a day, multiple technicians, making sure that we achieve our aims of safe, effective, thoughtful care. Thank you for joining us on our tour of VetSurg. We appreciate your interest in who we are and what we offer. Our goal is to provide the best possible care for your pet and support you during your pet's healthcare journey. Thank you for coming to see us.